Hi, Dr. Goldberg here, continuing our infectious disease lecture series. Today we're talking about human papillomavirus, otherwise known as HPV, or condyloma acuminata. HPV is certainly one of our most prevalent sexually transmitted diseases. It's the cause of genital warts, and there's at least 1 million new cases a year that occur. There's at least 60 DNA types of HPV, but serotypes 16 and 18 are associated with at least 70% of cervical cancers, but it causes many other problems that we'll talk about later. There's at least 11,000 new cases of cervical cancer a year, so it's an important disease to get on top of in terms of vaccination. Incubation period for HPV is about 1 to 20 months, and once these lesions are seen, often on the genitalia, obviously, or in the genitalia, electrocautery can be helpful, cryotherapy can be helpful, 5-FU topical, TCA, laser treatment, podophlin, and surgical excision are all ways of getting rid of this lesion. Recurrences are quite common. Vaccinations have come out in the last 10 years. Gardasil, which is a quadrivalent vaccine, came out first, but now we've got Gardasil 9 that contains the very important serogroups that are responsible for cervical cancer. It's got 6, 11, 16, 18, 31, 33, 35, 52, and 58. This has been passed by the FDA for males between the ages of 9 and 15, and in females between 9 and 26. There's also Cervarix available, which is a bivalent vaccine that covers HPV type 16 and 18. The regimen for vaccination is 3 times in 6 months and is usually very well tolerated. So what is HPV associated with besides cervical cancer? Well, anal cancer in both men and women, oral leukoplakia, oral squamous cell carcinoma, especially type 16, laryngeal papilloma, maxillary sinus papilloma, penile cancer, vaginal cancers, as well as vulvar cancers. So as we look at the population of people out there just in the U.S., a staggering amount of people have been exposed to this virus, and over 60% are negative for HPV in terms of seeing the disease on them, but 60% have antibodies that are detected. So the people who present with genital warts is just the tip of the iceberg, and then another 4 or 5% of patients, females, will be detected by colposcopy, and another 10% are HPV positive but colposcopy negative. So this is a huge disease that can be prevented with vaccination. So that's our primary recommendation. So let's get a hold of HPV with proper vaccination for young people and people with high risk. Thanks, Dr. Goldberg, signing off.